So our next session is going to be a hearing from two of our doctors who work with us, Dr. Joseph Loizzo and Dr. Amanda Sacks-Zimmerman.
When one gets a sort of life-threatening or a potentially serious diagnosis, at that time, often in the phase of acute treatment, the pressures to get treatment are so great that they become really all-encompassing. And women often experience in that phase a sort of just a very narrow focus on getting better, getting through the treatment, finding the best care, and so on and so forth. But afterwards, when the care has been delivered and they're sort of pronounced cured and really well, then they go back to everyday life. So at that point, we really try to deliver this intervention to help people gain tools to not just be able to live and survive in a sense, but to really be able to go back to thriving and to get their, not just the life back, but also feeling like I felt before, or possibly even feeling better than ever. And when we're in stress, it's the sympathetic fight-flight part of our nervous system that's activated, and that not only makes us feel worse, but also erodes our basic capacities for well-being and healing, again, in the brain and in the immune system and elsewhere in our bodies. A long series of increasingly sophisticated and interesting research using different kinds of meditative practices and other kinds of stress reduction practices that are kind of like exercise for the brain. We know exercise is great, it helps promote well-being in all of our organ systems, but we can also exercise our minds, our attention, and learn how to use our natural capacities to calm our systems. We're learning about neuroplasticity, right? We're learning, most of us have heard about this for a number of years now, that our brains are plastic and constantly being shaped by the way we think, the way we feel, the way we act. And the importance of mindfulness is that by training our attention, which we can do through very simple meditative exercises, we can learn how to sort of promote not only experience of well-being, but actual physical well-being, including better immunity. So of course we know about stress in terms of negative thinking or worrying about something like fear of recurrence, or it's fear about going to the doctor's office and people having mini panic attacks or when they walk by the hospital. But emotions are the biggest source of stress in our lives. Complicated, challenging, difficult interactions with other people, including the people we love the best. And so struggles at home, or how do we return to difficult relationships, becomes a key point of concern. And of course, in more recent years, since the mindfulness revolution, we've discovered how important compassion or positive social emotions are. And we've also discovered, vis-a-vis the whole idea of plasticity, that positive emotions can be trained, that they're not just some of us are nicer than others or whatever, but the reality is there's a natural capacity we all have to learn how to let go of the fear, the anger, the shame or insecurity, and learn how to cultivate these other alternative emotions like self-care, self-acceptance, self-compassion. This is something we find extremely important in healing. So we spend a lot of time working not just with attention training, but with emotional training, emotional intelligence training, based on self-compassion, learning how to shift the way we feel about ourselves and the way we experience our interactions with others, so that we're less triggered into our stress response and we're more emotionally feeling a sense of safety and connection and well-being. And then, of course, there are bottom-up practices, and those are practices that use the mind-body connection in the opposite direction. Instead of working with our mind to calm our body, we can also work with our body to calm our heart and our mind. So there we use practices including movement and posture, because the way we sit and move and hold our bodies gives messages to our brain about how safe we are. So if we're moving in a way we're not even aware of it, but we're sort of hunched over our phones or our desks or spending a lot of time guarding ourselves, we're giving our brains the message that maybe we're not so safe. We better not get too excited about things. We better be a little bit on guard. Whereas if we move graciously using practices like yoga or Tai Chi or Feldenkrais, we can learn how to give these reassuring cues of safety and connection from the body up to the brainstem. And of course, deep breathing is a very powerful way to use the older part of your nervous system because breathing into the abdomen stimulates a whole other part of our calming, relaxing nervous system that helps us calm even more profoundly. Learning how to live with less stress and more of a sense of safety and connection really allow you to steer the direction of your recovery toward, again, not just surviving, but really thriving and perhaps getting to a level of a sense of safety, connection, and well-being that you may not have ever even experienced before.
The brain is a plastic organ. In other words, it gets better with stimulation. Cognitive remediation just adds a level of organization to that stimulation so that through repetitive drills that are increasingly complex, we actually help the brain do better. So cognitive remediation is basically based on two different types of principles. There's the restorative principle, that we give you a bunch of attention exercises, probably similar to Dr. Loizzo, but probably also based in what we call sort of attention training, where we actually give you numbers and letters and narratives that you have to come back at with us to really show that you've encoded that information. It actually helps with short-term memory. So those are restorative exercises we do. We also do compensatory strategies, which really sort of call into play your abilities that you currently have and how do you use those abilities to compensate for what perhaps has been deficient through the treatment of cancer. But we use both, and the basic concept is we tap into your strengths to help you function cognitively better. And it works with our patients, as I said, in neurosurgery, with stroke patients, and there's evidence that it works in post-cancer treatment cognitive deficits as well. My colleague, Dr. Spat, and I have, with Dr. Moore, have a 4-session treatment that really focuses on emotional coping, attention training, memory training, and executive functioning training with the goal of helping people to function better after cancer treatment. And through these 4 sessions, our hope is that there's going to be a better functional outcome, using the strengths that you already have, but just bringing them out in an organized fashion to help you function better.